According to the United Nations, over the past 3 months, almost 1 million people have been displaced by a military offensive at the hands of Russia. Now, a displacement of this scale in such a short time is reported to be unprecedented since the Syrian conflict started 9 years ago. NGOs say camps are overcrowded and water and sanitation facilities are inadequate for the large numbers of people. Now, for more on this story, I'd like to welcome Gwen Young to the programme. She's the Managing Director of the Global Emergency Response Coalition, and she joins us from Washington, D.C. Gwen, thank you so much for being with us. Just how bad is the situation on the ground? Various NGOs and organizations are actually planning to step up both medical assistance and aid distributions from what we're hearing.
The situation is horrifying. We are appalled. We're an alliance of the leading humanitarian NGOs. We've been there since the crisis began in 2012. And what we're seeing on the ground is simply horrifying. Children are freezing on the streets. People are living on the streets. There is no food and water. And it's 2020. So what we're really asking is for people to step up and take action and pay attention. This large-scale movement, the rapidity of it, the pace of it, comes on top of, as you said, almost a decade-long war and very, very strained humanitarian systems.
And Gwen, presumably access for NGOs and medical care workers has been a challenge.
It has been a challenge. You have to remember that many of the international NGOs work with local NGOs, partners on the ground. The humanitarian personnel themselves are displaced. They're working in situations that are strained with little resources and under threats of violence. So it's very, very difficult, even for those trying to deliver aid, trying to help and work with those most urgent in need to save lives. It's a very, very horrific situation.
It's a horrific situation, and one health worker on the ground has spoken about this global panic that we're currently facing with COVID-19. Yet in Idlib, he said residents are actually faced with more challenging diseases that perhaps the international community is turning a blind eye to. What are your thoughts on that statement?
Well, my thoughts on that statement is when people are living on the streets, when they're, over 80% of the people that are displaced are not living in formal camps. Even if they were in the camps are already overcrowded. So they're living without proper water, without proper food, without proper hygiene. So you have all the host of diseases, not the least of which is malnutrition. As I said, it's cold and people are freezing on the ground, but you've got a series of waterborne diseases, and you have no medical centers. You have 84 closing last week in and of themselves. So you have really little medical personnel and little help for these people on the ground. So diseases like cholera can spread very rapidly. People with acute and emergency diseases do not simply have healthcare workers that can see them. So it's pretty terrifying on the ground for these people that are suffering from a range of diseases.
You just mentioned problems with water, food, hygiene. Let's now talk about the displaced themselves. Reports are that over 80% of them are women and children.
Yeah, 560,000 of them are women and children. And one thing you have to remember is that since they're not in formal situations, they also don't have schools, and there's not a lot of safe places for these women and children to be. And we just found out from one of our member NGOs that 20% almost of women in the camps themselves, and just the camps, are lactating and pregnant women. So you've got this very complicated situation that, in addition to safety, in addition to disease and healthcare, as we've just talked, you've got extreme mental anguish and extreme psychological damage that can happen to these women and children.
Gwen, what measures does your organization suggest be taken to try and help this fast unraveling crisis?
Since we have leading 7 NGOs in this case, we can cover a gamut of things, but we do a lot of safe spaces for children. We do protection work. We do a lot of psychosocial support for both children, women, and men, so the people living in the camps, the people living in the streets. We do healthcare. We do cash assistance. And we do general provision of services to try to help build shelters and try to create a stable situation for temporary. You have to remember that some of these people have moved 2 or 3 times as well. So what we're trying to do is provide all the support they need, not just from shelter, but to the psychosocial angles, which includes trying to set up smaller education centers where children can actually play. One of our NGOs was saying, when you ask children what they want right now in Idlib, what they want is they want to have friends, they want to feel safe, and they want to play with their friends, and of course they want to go to school. So they want to be in a situation where they're not feeling like bombing is a normal occurrence, they're going to have to move, and they're not feeling entirely uncertain as to what they will see tomorrow morning.
Gwen Young of the Global Emergency Response Coalition, thank you so much for speaking to us here on Middle East Matters at the time when the future of the residents of Idlib, of course, continues to hang in the balance.